all situated on sacred land. Today, I join you from the unceded lands of the Lenni Lenape and Nanticoke tribe and acknowledge their care of these lands over time. At the Y, we aim to create a space to learn with passion, to listen with intent, and to understand the depth and wisdom within our communities across the state of Delaware. This community conversation celebrates the diversity and richness of what unites us as people. So let's now give a warm welcome to Lauren Jumps from the Delaware Department of Health and Social Services, Division of Services for Aging Adults and Physical Disabilities. That's a mouthful, but she's also known as DSAPID. Lauren, you want to tell us a little bit about yourself?
Hi, Jen. Thanks so much. Hi, everyone. My name is Lauren Jumps. I am a planner with the Delaware Division of Services for Aging and Adults with Physical Disabilities, also known as DSAPID. I'm also a part-time YMCA staff person. I have been with the Brandywine YMCA in the aquatics department for 8 years. So I am very excited that my part-time job and my full-time job have come together so wonderfully today. And I'm very excited to share some information with you about our division.
Awesome. Thank you, Lauren. Esther Salami Williams is also a practical nurse who specializes in senior care, and she's our second speaker today. Esther, do you want to tell us a little bit about yourself?
Thank you, Jen. Good morning, everyone. My name is Esther Salami Williams. I am the co-owner and operator of Elite Senior Advisors, and I also own CW Senior Support. I have been a nurse for over 25 years, and I have several certifications in geriatric, healthcare administration, as well as dementia. So I'm very, very excited to be here to be able to talk about, our services and how we're able to support those seniors who looking for an elder care manager or senior living placement assistance. Thank you, Jen. Back to you.
Thank you. So we're going to start off with Lauren. Lauren, can you please share some information from the Department of Health and Social Services for us on aging senior care?
Absolutely. I'm going to go ahead and share my screen. And while we're doing that, just as a quick, fun little question for you guys, just use your favorite reaction in the chat or, raise your hand. How many of you know of our division or, know who we are or, know a little bit about what we do, or you've heard of us, but you have no idea? Not seeing a lot of reactions. Well, hopefully by the end of this call, you'll have some information and resources that you can use in your branches to work with the seniors that you serve. So DSAPID is the largest of 11 divisions within the Department of Health and Social Services. And our mission is to promote dignity, respect, and inclusion for older adults and people with disabilities. So we strive to preserve health, dignity, and self-sufficiency for older people and individuals with physical disabilities. And we strive to do that by providing access to and coordination of the right services at the right time and in the right place. DSAPID currently serves about 15,000 individuals with home and community-based services. And that includes our division's core services of nutrition and home health, adult caregiver supports, legal assistance, and information and assistance through the Aging and Disability Resource Center, also known as the ADRC. That includes case management, options counseling, community nursing, adult protective services, and residential care at the Delaware Hospital for the Chronically Ill. The Delaware Hospital for the Chronically Ill, or DHCI, was built in 1932. It is a 62-acre, 205-bed licensed skilled nursing facility. And DHCI has a long and distinguished history of providing 5-star skilled nursing care to Delawareans who have no other options for their care. And we're very excited because of this history and the tireless efforts of our staff. DHCI was awarded $50 million in ARPA funds for the construction of a new hospital so we can modernize our facilities and continue to provide unparalleled care for Delaware's most vulnerable. We currently have a resident census of 83 individuals. So now let's get into why I'm here and why this is important. So DSAPID services are so important because Americans are currently living longer than ever. And that means that right now about 10,000 people per day are turning 65. Delaware specifically is actually currently outpacing most of the nation in our aging population. From 2010 to 2020, the population of adults over the age of 65 in Delaware increased by 52%. So 20% of the total population in Delaware, or roughly 1 in 4 Delawareans, is currently over the age of 65, which means that they are eligible for Older Americans Act programs and services. So if you're wondering what kind of services are available, what can you do, what do I look for? This is a list of some of the services that we provide or offer individuals through our division. And you might notice that some of these services overlap with Delaware Medicaid or Diamond State Healthcare Plan, also known as DSH-P+. And that's because individuals who qualify for DSH-P+ may not be eligible for services through DSAPID, but that doesn't mean that we can't get them to the right place. So our goal through our ADRC and our no wrong door system is to serve as a hub and coordinating entity for partners and service providers throughout the aging and disability networks across the state of Delaware. Our ADRC is a single point of entry for information. So any information that you need, assistance, streamline access to long-term services and supports for older adults and individuals with disabilities. This is a 24/7 support. So they're available by phone, email, or our website. And the ADRC can connect aging Delawareans with the services they need, including case management, congregate and home delivered meals, legal services, nursing home transition information, respite care, lifespan respite care for caregivers, and adult protective services. So with that being said, the question becomes, what comes next? As Delaware's aging population continues to grow, what do we do next, and how do we continue to serve as many people as we can? Our mission and vision includes promoting healthy and vibrant aging in the state of Delaware, and to change the conversation around aging, and to identify those who are aging, but also to promote this idea of aging unbound and aging vibrantly in the state of Delaware. DSAPID's path forward includes healthy homes, active living, and community integration to allow Delawareans to age in place where and how they choose. So this includes home repairs and modification programs to allow homes to remain clean, well ventilated, and pest-free so that individuals can stay in their homes as long as possible. This includes the promotion of healthy lifestyles and wellness activities that enhance the ability to age in place. And the assistance of developing individualized plans for equitable access to community services and activities. So thank you very much for taking the time to listen to the services that our division has to offer, and we are very excited to share this information with you.
Awesome. Thank you so much, Lauren. We appreciate you sharing those valuable resources with us, and I know that they will have a potential impact on someone on this call. So thank you for sharing with us. Now I'd like to invite Esther to share from her experience as a practical nurse who focuses on senior care.
Thank you, Jen, for the introduction. I'm honored to present to the YMCA staff of Delaware. As she said before, my name is Esther Selamy Williams. I'm the owner of Elite Senior Advisors and CW Senior Support. I hold several certifications in assisted living administration, geriatrics, and dementia care. So today, my goal is to present a way to support the senior population in your branches. So let's start off with signs to look for when a senior enters your branch or approach the desk. So signs that we're looking for, and I'm going to use Mr. Smith as my fictitious person that I'm going to incorporate in this presentation. So Mr. Smith walks in. Mr. Smith may be somebody who has been a member of your branch for several years. You are familiar with him. He comes in, he's always pleasant. And today he comes in and here's some of the physical signs that you may notice, that he's disheveled in appearance and with clothing, or just his hair isn't combed. He's always, always well groomed, but today he looks disheveled, just not himself. There's some physical injuries noted, or poor personal hygiene. Again, he may be wearing the same thing that he's been wearing the last few days. There's an odor coming from him, or you might notice a bandage or something that is, again, not typical of Mr. Smith coming into your branch. He's, you know, sometimes he has a cane that he uses. But today it's missing. He's coming into your branch and he's not using his assistive device. Or he's staggering or abnormal physical movement. He might be, you know, flinching or something's going on. So some of the behavioral changes to note would be, you know, he's wandering around, not quite sure how to check in to your center. He's having some confusion, anxiety. You may, you know, say hello and he's answering in a higher pitched tone. It's angry, it's confused. He's unaware of his location or why he's there. So he comes in, he doesn't remember how to check in. He doesn't remember where he's going, what program he's there for. You know, he's walking into one of the offices that's where he's not supposed to be. So those are some of the things, again, signs to look for. So what happens next? What are the next steps when Mr. Smith comes in and he's not himself? So with any type of older adult, sometimes they start off with not dementia, the diagnosis of dementia, but more of a cognitive decline is noted. So when you see him, you know, speak in a normal tone voice, avoid speeding up the way that I may be talking a little fast, slow down and change your volume. So without changing your volume. So, you know, don't talk to him like a child. Don't speak down to him. You know, you could say, hi, Mr. Smith, how you doing today? Make eye contact, remain in eye shot while speaking. If possible, if you happen to be at the front desk and he comes in and, you know, there's a lot going on at the front desk. You know, people are checking in. There's where the lockers are. You know, there's a little sitting area. There's a lot happening. With seniors, that could be an overwhelming stimulation for them. So, you know, bringing him over to the side, away, if you're able to leave the front desk, if there's somebody to back you up, you know, take him over to the side for a moment and speak with him, and the quiet, you know, the normal tone voice. Let them know when he's telling you what's going on, let him know that you hear him. Repeat back what he's saying to you. You know, Mr. Smith, this is, you know, I understand this is what you're saying, X, Y, and Z. And we'll talk about that with our next slide of some of the questions to ask. Some of the questions you could ask him is, again, if you feel that he doesn't remember you, introduce yourself again and say, you know, would you mind if I walk with you to your yoga class or to your aquatic class? You know, ask that question, kind of give them, you know, that option to say yes or no. Ask leading open-ended questions. You know, Mr. Smith, you know, is your daughter, if you're familiar, I mean, is your daughter in town? Is she heading back to Boston? You know, how was your weekend? You know, if he has a spouse, you know, how is your spouse doing? Just open-ended where you can kind of get him part of that conversation. If also, again, you can ask him things like, you know, how do you think about, if he's a swimmer, you know, how do you think about the swimming class? Are you enjoying that? Is that what you're here for? Things like that. Just open-ended questions that can get him talking a little bit, comfortable with you, in order for you to be able to see what's going on. Also, during the questionnaire, ask for permission to say, you know, I would love to be able to share your information with somebody who may be able to help you. Gathering that information from him, again, and asking that permission to be able to find support for him is super important as well. The last part, once you're asking questions, is here are some of the actions to take. Be proactive in engaging with the seniors. Sometimes, again, you're probably the only person that they see when they come to the branch. You may be the only person that actually has a warm smile, saying hello. So those are really important to be proactive, engaging with the seniors. Ask questions to offer more support when possible. For example, when you are seeing these type of behavioral changes or physical changes, again, ask, are you okay? Just ask questions, engage. Don't let them walk away. Ask how you can best support them. Sometimes, unfortunately, they may not be able to articulate what is the best way for you to be able to support them. So hopefully there's somebody in your branch that you can connect them with, that they can sit down one-on-one before they leave that branch. Or sometimes, depending upon what's going on with them healthcare wise, you may not be able to he may not be able to do his class. So now you're having to find somebody to say, he's not himself today. I don't think it's good for him to get in the pool. Let me see if I can find an administrator or someone that can kind of talk with him to kind of de-escalate the situation, if there is a de-escalation part of it or something like that. Work with your membership to connect with seniors who've been absent. If you notice that Mr. Smith has been gone for a month or 2 months, and you're like, you know what, he usually comes around noontime and I haven't seen him in a while. I wonder, ask your membership person to see if they can give them a call to see if they are okay, if they've been absent. Also, develop a system at the front desk to connect them to emergency contact support for the vulnerable seniors. Again, hopefully there is somebody that is assigned in your branches that you guys can immediately, especially if you're covering the front desk and you don't have backup, but you still notice there's something going on. So hopefully there's someone that you can call to connect them to in order for them to sit down and have that conversation. Create space for them during your board of directors or somebody who is in the healthcare field to be able to have that conversation, educate yourself. And, I noticed that your branches do a phenomenal job on education, on Alzheimer's, dementia, senior support. And there's so many diagnoses out there, and you don't have to be a physician or a nurse or anybody to be able to pick up basic cues that somebody is in crisis and needs that support from you. So, and then also another thing that I would say, perform regular check-ins with your seniors with their contact and emergency information. I would say every 6 months, things change. Spouses pass away, they change addresses, they may have moved from a senior, from their private home into a senior living community. Sometimes their children are out of town and they don't have that local support. So being able to have that, or having someone do regular check-ins with, I would say seniors over 70, making sure that, they have all the support that they need, might be a wonderful addition to some of the things that you guys do over in your branches. So those are some of the things that that I wanted to be able to share with you. And hopefully that was some helpful information. The last slide is my contact information. I'm sure also Pejin or Jen would be able to send this out, or please feel free to copy that. My email, my telephone number, you're able to call and text it. If there is a question that you guys may have, feel free to reach out to me at any time. Thank you, and back to Jen.
Thanks, Esther. That is some really great tips to help us interact with our seniors in our buildings. And I think that we can all benefit from engaging and interacting with our seniors. We are now going to move to the open floor for the audience to ask questions. So if you remember at the beginning of the conversation today, I asked that you put your questions in the chat. I currently don't see anything, but you can do that at any time. So I'll start with a couple questions. I actually have a couple questions that I'd like to ask. So on May 3rd, Lauren, the U.S. Surgeon General raised an alarm about the devastating impact on the epidemic of loneliness in our aging adult population. And it's caused seniors specifically to face physical health consequences such as poor or insufficient connection, including a 29% risk of heart disease, a 32% risk of stroke, and a 50% increased risk of developing dementia for older adults. Additionally, lacking social connection increases risk of premature death by more than 60%. In your experience, what are the key challenges faced by seniors when accessing healthcare and social services in Delaware? Are there any specific barriers that you have identified, and how can organizations like the YMCA of Delaware address these challenges? I know that's a long one.
That is, but it is also a great question. Thank you so much. So aging Delawareans experience a vast array of barriers when accessing health and social services. And when our division was working with the state legislature on the Aging in Place Working Group, that was a group dedicated to assessing current home and community-based service infrastructure. It was determined that some of the barriers for seniors in Delaware may include the availability of accessible housing. They have challenges affording housing. They experience social isolation. There's a lack of affordable and accessible home and community-based services. They often experience financial burdens and they're not able to afford services. And Delaware is currently experiencing a shortage in the healthcare workforce. So organizations like the YMCA can really help address these challenges by ensuring that resources are readily available when seniors seek them out. So thanks to PyGen, every YMCA branch in the state of Delaware now has a box or two of our guide to services, which can help seniors identify the services and supports that they may need to help them age in place where and how they choose. People trust the Y, and if you have these resources and the information available and you're aware of just some of the basic information that's provided in those resources, you can really set the seniors you serve up for success.
Awesome. Thanks, Lauren. Esther, as a certified geriatric professional, what are some common health concerns or conditions that you frequently encounter amongst seniors, and how can organizations like the YMCA of Delaware incorporate preventative measures or programs to address these concerns proactively?
That is a great question. So seniors, cognitive decline is a big one. Heart disease, strokes are another one that is very high among seniors. You know, when they're coming into, like I said earlier, when they're coming into your branch and you're noticing that there's changes with them, paying attention, that they are, again, disheveled, they may have slurred speech, they are pacing, they are not making eye contact, there are, you know, unsteady gait. Those are the things that are very common that you should definitely look at and be able to stop that senior and have a conversation. And if, again, they're not themselves, these are things that, you know, having somebody, a contact person to reach out to, or being able to say, hey, let me take you over to our director so they can speak with you and pick out those signs. When you're talking about slurred speech and when you're talking about they just look like their face is drooping, you know, that's a sign of a stroke. If they are coming in extremely confused, disheveled, just not themselves, or, you know, that's a sign that they're starting to have some type of cognitive decline, or as simple as having a urinary tract infection. So things like that, again, there's a thing called orphan seniors. Orphan seniors are seniors who don't have loved ones, who didn't have children, who all their loved ones have passed away. They are alone. So when they're coming into your branch, you're probably the only person that they're seeing, the only type of human interaction and communication that they're having. So, you know, not putting the burden on you, but it's also very important to be able to interact with that aging population, to be able to get familiarized with them so you know what's going on. So if the habits have changed, most seniors are creatures of habit. They do not change the way that they do things. So if something is off about them, it's just not typical how they come into your branch, then that would be the time to have that conversation and being that eyes and ears for that particular senior and advocating for a support or guidance for them, whether through DSAP or calling myself as a nurse who does elder care management, just somebody to be able to connect them with. So that way, you know, they're getting the support and care that they need.
Thanks, Esther.
You're welcome.
We have a question in the chat from Kristen Baronio. We have decreased our opportunities for seniors to engage since COVID, including weekly social events, coffee areas, patio out back where they gathered, evening classes that accommodate seniors only, and their annual luncheon. How will the Y engage in returning to some of these activities? Kristen, I think that's a great question. And I think that's something that we should all bring to our leadership team and start working towards planning more activities for senior, maybe putting together a senior program. So I think that's definitely something that we should all work with our branch leadership. And I will certainly bring that to membership too, as we're planning events for next year, and we're getting ready to plan 2024. I think it's a great opportunity for us to try to plan additional events for our seniors. So thank you for that comment. And yes, I think that's an important priority for 2024.
Jen, I can speak to a little bit of that for Brandywine. So we are bringing back the senior lunch, and we talked about that at a recent meeting, and we've restarted. I think they play bunco. Steph Bowden, who used to do quite a lot with seniors prior to COVID, is back doing. I think it's monthly right now, social time in our teen center. And they're playing board games and whatnot. So that's been good to see. So we're working towards that. We've gotten some of it back, but to Chris's point, we had quite a lot pre-COVID. So we're trying to revive some of those really cool services that we offered.
Awesome. And thank you, Dot. And that the speaker just a minute ago was Doc McFadden, and she is our fitness director over at our Brandywine location. So thanks for piping in there, Dot. We appreciate that. We have another question in the chat. How do we engage those conversations if possibly the person isn't receptive to the interaction or even want the conversation? How do we engage to make them feel comfortable to have a difficult conversation? So I'm going to throw this one back to one of our speakers. Does anyone want to take this?
I guess that was part of my conversation. So you're right. Not everybody's going to be receptive. That's a very good question. Not everyone is going to be receptive to that conversation. However, hopefully somebody can get their name and their information at least, so that at least we can do a follow-up question you call, or even alerting somebody that is at the center, one of the management team that is at the center, at your branch. So that way once they're done with the class, that they can kind of approach them, or, that sort of thing. And to engage them and make them feel more comfortable. Hopefully, again, getting that basic information for them, and then probably having someone give them a call. If they don't want to engage after their class, then maybe we can wait, 24 hours and give them a call and, engage with them in that particular conversation. Now, if you feel like it's more of a health concern, I would say do not let them leave the center. Maybe having somebody redirect them back into another program. Can we sit down and have some coffee? Maybe sometimes it could be that they're not comfortable with a female, or they're not comfortable with the male, or they're not comfortable with, try to see what they're comfortable with, and being able to keep them, in the center. If it's something health-wise that you feel like they may be having a stroke, or they shouldn't be driving. This is another huge conversation that I deal with on a daily basis. Seniors who are coming in who has no business driving, and they're coming in and it's like, oh my gosh, what do I do? What do I say? They shouldn't be behind the wheel. I think I take a license away from a senior almost once a month at this point when I come into interaction, and they're hard of hearing, they can't see, but they're driving. It's a nightmare, but it happens, and it's the reality of it, because that's probably their last little ditch of independence that they have. And once that's taken away from them, they get upset. And I understand, but I also understand the safety for them as well as the safety for people who are out on the road. So, again, definitely get the information. If it's health-wise, obviously, I would always say if it's an emergency and you think that they're possibly having a medical crisis, call 911. But also get that particular information and reach out to your support team to be able to see what's the next step for that particular senior. Hopefully that answered your question. But seniors are, again, a creature of habit. They are set in their ways and they like things very particular. So that is a very good question. And hopefully we can kind of get them someone can resonate with them in order for them to be able to, interact in a conversation with you.
And if I could, just to piggyback off of Esther's comments, if you really suspect that there's something wrong, if you suspect abuse, neglect, or exploitation of any of the seniors that come into your facilities, please make the call to our Adult Protective Services line, or call our Aging and Disability Resource Center if you're really not sure, but you're really concerned. We have staff available 24/7 who can help, with resources and understanding. If you have this information and you are genuinely concerned, please make that call.
I agree.
So we have a couple more questions in the chat, and I'm not quite sure I have all of the answers here, but the first one is from Marie Reedy, and she says, is it appropriate to utilize the emergency contact info if we suspect there is a cognitive or physical issue? And Marie, this is a tough one because the emergency contact is there in case of emergency. And I think that is a tough conversation to potentially have with someone. If you notice some things that are happening slowly, I don't have the right answer. Does Lauren or Esther, do you have an answer here? Whether the emergency contact should be used if you notice some decline?
I would say, yeah, well, it depends on what your company's policies are. If that's what the emergency contact is for an emergency. If you're noticing that is a decline or there's something that's going on, it is definitely, I think, appropriate to reach out to them, if not to that emergency contact, because again, they may have been a change. They may not even be, the emergency contact may have passed away, may no longer be in the area. There's something that's going on and you notice something, I think you should say something. For me as a nurse, I'm automatically a mandated reporter. So if I feel that there is something that is happening, I have the obligation as a nurse or as a professional to be able to report that. And if you don't feel comfortable, I think that you should speak to your manager or supervisor at each branch and be able to say, I saw Mr. Smith come in today. I'm really concerned. There's something not right with them, or are you the boss? To be able to, have that conversation and say, I don't feel comfortable, but this is something that I'm really concerned about. Speak to your manager and they can go from there. But definitely, I feel that you should be able to have, to utilize that emergency contact. And Lauren, you can piggyback off of that if you have anything.
I agree, absolutely. If you have that emergency contact information available and you are concerned, definitely make use of that information, reach out to the nearest family member, and also be aware that everyone is a mandated reporter for Adult Protective Services. So it's not just for children. So if there is a question of, do we call the emergency contact? Do we call APS? You should and have to make that call to APS.
And I would say if there's things that you're seeing, things that Esther was mentioning, disheveled appearance, not quite the same as they have been, or they could potentially hurt themselves by not bringing in their cane or their walker, I think that would be an important conversation to have with someone that they've listed on their contacts. All right. So Mike Jumps says, I think Lauren kind of answered this, but he said, is there ever an instance where we as Y staff should consider making a call to APS or Adult Protective Services? Do we have a policy in place if we receive concerns from our frontline staff? Mike, I don't know if we have a policy in place, but we should probably have one. I see Patty V. Patty V, are you taking notes? In HR, I see Patty on the call, but we should definitely look into that, and we will make a note of that as well. But Mike says we take so many trainings surrounding the protection of children, but not necessarily for seniors. And I do think that's a very important point, Mike, that we should consider looking at our seniors just like we do our children. All right, I don't see any more in the chat right now, unless I've not scrolled down. Hang on. Oh, there's some more. Oh, and then Mike said disregard. She just answered that. So Delise Sterling, when they asked if they can be referred to organizations for assistance and they declined to, how do we handle this so as not to violate their human rights? And so, Delise, that's a great point. And I think that's a great point with the emergency contact question. We probably should ask them first. Do you mind if I call and speak to your emergency contact? Because to Esther's point, they might have changed. There might be someone else that they would like us to talk to, or maybe they don't want us to talk to anyone at that point in time. So I think we have to be respectful of their human rights as well. Do you have an answer on that about violation of the human rights? Our speakers?
Well, so Delise, my question, I guess I have a follow-up question for you. You said when asked if they can be referred to organizations for assistance, are you saying that they're asking for the information, or you are offering to refer them to other agencies for information?
So, hello everyone, sorry. So Esther had mentioned in her speech that we could ask sometimes if they come in and they're seemingly look disheveled and all that, or seem out of the norm. And at that point we could ask them, but I was thinking at that point I would not get their cognitive function would not be in place either. So I probably would not get a correct answer or an answer at all. So she did say we could ask them if they want to be referred to other services, which is outside. So that was where the question came from.
Okay. Yeah, I mean, if you ask and they decline, they are absolutely able to do that. But again, this does kind of come into, you know, your judgment call as frontline staff. You interact with these individuals regularly, you see them more often. So if this is completely out of the norm and you're anticipating that something just really isn't right, make that call to APS or reach out to their emergency contact and say, hey, something's really not right with Mr. Smith today. Do you think you could come down and get him? So I think that first line of defense, if they are saying, you know, I don't want you to refer me to anybody else, you don't need to, I'm fine, but you're concerned about them leaving the branch, then that would be an opportunity to utilize that emergency contact information.
And I'm going to piggyback off of that. That's a very great question, Delise, and hopefully I'm saying your name right. Is no senior is ever going to ask for help. I'm going to say that loud and clear. They will never ask for help. I've had my practice for 3 years now, and every call that I've made has been from somebody else, or any call that I've gotten has been from somebody else. And even when I see my seniors and they're referred by their family members and I go and meet them, they're like, I'm fine. Why are you here? Nobody wants, they don't want me there. But once they realize I'm not here to take away their freedom, their autonomy, I am here to support them so they can live in the least restrictive environment as possible, then they become a little bit more open. And so number one, they're never going to ask for help. And a lot of times they're always going to say, oh, no, I'm fine. Don't worry about me. Don't worry about me. But if your gut instinct is telling you something is wrong, I don't want to, again, go against the YMCA policy, but I feel that it's due diligence for you to be at least able to bring it on to the management team for them to be able to, again, reach out for assistance. As well as a lot of times when you say, well, call this number, they will never call a number. So a lot of times you have to ask and say, hey, I want to be able to refer you over. And if they're having a cognitive decline, then if you feel like they're having a cognitive decline at that moment, and that's your judgment, then at that point you have to do what's best for them, because they can't make a good conscious call for themselves. If somebody's in the middle of a stroke, somebody's in the middle of an episode or a dementia or cognitive crisis, they cannot make a conscious decision for themselves. So we go back to that thing of, okay, let's go ahead and call the emergency contact, reach out to, again, the management team. And hopefully, this will spark a conversation with each branch as far as getting a system in place for the seniors, and then being able to support and guide them. And like I said, like Lauren said, if you feel like it's not safe for them to leave the center, let's distract them. Let's, get them go into another program, get somebody involved, so that way they're not leaving that branch with an emergency issue.
Thank you.
You're welcome.
Great questions, everyone.
I know.
Okay, we have our host asking, how often should emergency contact information and other information related to membership be updated? Esther?
Oh, is that me? Oh, okay. So, I mean, for me, I would say every 6 months. And I don't know what your staffing looks like. And the reason why I say that, because things with seniors change so drastically. Healthcare changes so drastically. Here today, gone tomorrow. So a lot of times being able to, and I don't know when they're checking in, that you guys, could do it periodically. Hey, I noticed that we haven't checked on, we haven't updated your information, or even having a different membership questionnaire for seniors, or having a tickler on your computer that say, this is somebody who's over 65 or 70, let's just make sure that the information is correct, and make little notes. Sometimes it's not important for the regular members, but knowing, do they have close family members? Like asking different questions for that senior population might be a benefit for you guys. So in the event that there is an emergency, that we have that information. Are they alone? Do they have any kids that live, who do they live with? Do you have any family that's close by? Emergency contact, who is that emergency contact? Things like that. I feel that it should be updated at least every 6 months, because life happens and, we can't keep track of everybody. And I'm sure there's hundreds, if not thousands of members in Delaware that are seniors that are part of your branches, and that, and it's a lot, it's cumbersome, but I think every 6 months would be ideal.
Awesome, thank you.
You're welcome.
Peijen shot a softball my way. Thanks, Peijen. Jen, she says, Jen, could you share a little bit about silver sneakers? We get that question a lot at the membership desk, and how do we address that? So for those of you on the call that don't know, silver sneakers is a plan that pays for memberships. It's an insurance plan that pays for memberships and subsidizes memberships for participants in their plan. Silver Sneakers is just one of the many entities out there that offers these plans to seniors. And we do not accept Silver Sneakers or Renew Active here in Delaware. And the reason behind that is the reimbursement side from the insurance plan to the YMCA of Delaware. So the reimbursement on the back end it's per swipe, and it generally is about $1.50 to $3.50 per swipe on average per visit, up to 12 visits typically. And so the plan works with different agencies to accept their plan. But they're really geared towards like a Planet Fitness model. But of course, the seniors come in, they love our pools. We have a lot of different offerings for them. Kristen mentioned we had many different offerings for seniors prior to 2019. And unfortunately, we have to be able to pay for those things. So Silver Sneakers and Renew Active do not provide the reimbursement to cover our services out to our members. So that's really why we don't participate in those programs.
Jen, can I add to that?
Sure.
So, there are other things that we do that help mitigate that cost with our scholarship program, and the senior rate is lower than the general member rate to begin with. So there are other ways that we're assisting with the cost aspect of that.
So Dot, I'm glad you brought that up. And many times when I talk to the seniors on the phone, they are unaware of our financial assistance program. And they also think that they wouldn't qualify for our programs. And so we are a sliding scale. So we have an income-based scale, and the discount very well could apply to them. So I always encourage the seniors to apply. Marie says, I have had a few members come in to request their annual statement and list of visits. They submit to their insurance and receive a reimbursement. Oh, great, Marie. That's fantastic. So there might be some other ways that seniors can receive reimbursement for their memberships. Awesome. All right. So we have a couple other questions. Lauren, for you. Collaboration and partnerships are crucial in serving seniors effectively. From your perspective, how can organizations like the YMCA of Delaware collaborate with government agencies and other stakeholders to create a comprehensive and holistic support system for seniors? Are there any specific strategies or models that have proven successful in promoting collaboration?
Thanks so much, Jen. This is another really great question. Organizations like the Y can collaborate with government agencies and other stakeholders by first identifying where the need for services is highest. So understanding the population that you serve and being able to understand their needs is the first step in understanding how to best collaborate with other agencies and which agencies can help you best meet their needs. For example, the Sussex County YMCA likely has the highest population of served seniors because of the considerably higher percentage of retirees that live in Sussex County. Whereas the Central and the Walnut Street Ys may serve a higher needs population due to their locations in areas inhabited by historically underserved populations. The Y can help government agencies and other stakeholders develop programming that's innovative and addresses specific needs of those populations to ensure that the seniors are aging well and aging in place in a way that they choose.
Thank you. Oh, here, a good one from Rhonda. How do we support our own aging staff members who are possibly dealing with health issues but don't say anything and you notice a change in them as stated in the examples? What should we do as employees to help assist them to make sure they're okay? Great question.
I would say it's an HR issue. I don't know. So I don't want to misspeak.
Patty's on the call.
But that's a good question, though.
Yeah, it's a great question. I don't have an answer for you on that, but I would think that, you talk to the supervisor because I'm sure we're going to have staff. I'm an older adult. That if things start declining and supervisors notice that, it would be, a conversation that needs to be had with HR to figure out what we might need to do. I'm sure each individual situation would be different.
Thank you, Patty.
This is Dot again. I've been thinking a lot about this conversation, and someone had mentioned earlier, what if the person you're addressing isn't receptive to it, is in denial or whatever. And I think back to the work that we do in general. The more rapport that we establish with our members, the better our relationships are when things are good. The easier it's going to be to have any of these conversations, whether it's a coworker or a member, because you've already developed some trust and rapport there. So, I mean, that underlying part of our work, this is a great example how if we don't do that well, we're not going to notice, number one, and we're not going to feel comfortable talking about it. So, yeah, it just reminds me of how important it is to develop those relationships.
Thanks again, Dot. Paijan, I think you found your next moderator for. Okay, we got another one for Esther. Building strong relationships and fostering a sense of community can greatly enhance seniors' quality of life. Based on your experience, what are some effective ways that the YMCA of Delaware can create an inclusive and supportive environment for seniors? Are there any specific examples of community building activities or events that have been successful in engaging and connecting them together?
Oh, that's a great question. So in my experience, and like I said, most of my nursing career has been with the geriatric population. I just absolutely love them. They're amazing. But having those programs that was, I guess, that kind of stopped before COVID really took a toll on the population, and COVID took a toll on regular people, folks like you and I, as well as the senior population. People were locked in their homes. People were locked, away from their family members, especially, you can only see them through the window. I mean, it's very tough. So being able to start implementing things back into the community for your programs is crucial. Like you said, the coffee, the classes, just regular, games, Bunko they're teaching me how to Bunko. I have never heard of the game before, but that's a new thing that that is a big deal. That collaboration, playing cards, just engaging them again, that they know that they have a social network of people of like age, like-minded, is very important for seniors. A lot of times I will see my patients and they'll say, I gotta go because I've got to go play bingo. So what is it that you need? Goodbye. And I'm like, well, I'm here to do my weekly visit and just checking in to make sure, no, it's fine. You got to come tomorrow. I'm fine because I got to go play bingo. And I'm like, okay, so it's funny because that's when they feel like they're part of a team, a group, or a network, it makes them not become so lonely in their home. It makes them and there's some seniors that I have right now that I've been trying to encourage, like, let's get you into the Y, let's get you into, different, senior centers, whatever I can get them to get out of their house, because they can become very reclusive. And COVID made that so easy for them to become reclusive in their environment and not be able to be part of that. So bringing those programs back is super important for the seniors. So hopefully you guys can, even like I said, not all at the same time, but one at a time, one by one, until they're all back together, I think is very important. Or even having somebody in your center, give them a call. Hey, I'm just checking in. Hi, how are you? Just making sure that you're doing okay. Do you need anything? Are you making sure, are you eating okay? Are you, getting out? Are you, do you get groceries? Do you have what you need? Sometimes just making that phone call will matter to them, that they know that somebody actually cares, that somebody at the Y. But, I live in North Wilmington, so the Brandywine one is my branch that I typically would go to or take my seniors to. And again, they love it. It's a camaraderie. They get to people watch, whatever the case may be. And one time, one of my patients was part of your aquatic, and she made me get into a swimsuit so I can get into the pool with her. And that was my visit with her, was taking her to the Y, because she doesn't drive, and and I watched her go back and forth to do some exercises, and she wanted me to get into the pool with her. So I brought my bathing suit and I just sat there. I don't even swim, but I did it because that was her interaction and that's what she needed. And we took a selfie together. It is on her fridge. And her daughter is a journalist, and she's just like, my mom talked about that for months. Because again, it was something that she wanted to do. It's not my thing, but she wanted it and loved it. And it just having that conversation, calling, checking in, even knowing them by name is a big deal when they come in and you say, hi, Mr. Ronald, or hi, Mrs. Smith, or whatever. It makes them feel good because it makes them feel like they were part of your branch. So. And I can talk about seniors forever, so please don't keep me going.
We love it that you love seniors.
I do.
It's amazing. I think also groups form naturally, and Dot, I'm sure you're still there. We've seen a lot of groups that just form naturally as they're in like little group drinking coffee in the lobby, talking about a book. And so I think that the Y also just provides space to be able to do that, and then to invite other members in. So I think that's part of what we do as well. We just create the spaces that encourage that. All right, I think we might have time. We've got like 3 minutes left, so we might have time for one more question, which I think it's kind of similar. This is for you, Lauren. As we aim to provide the best possible care and support for seniors, what are some innovative programs or initiatives that you have seen or implemented that have had a positive impact on the well-being of aging adults?
I am so excited that you asked this question, because we have two really amazing programs that I'm really excited to spotlight for everyone. So the first of these two programs is our Healthy Homes program. And that is through a partnership with all 3 Delaware Habitat for Humanity organizations. The Healthy Homes program benefits Delawareans 60 years of age or older. It addresses home health hazards in order to keep homes clean, dry, ventilated, pest-free, contaminant-free, and maintained. And it helps low-income homeowners impacted by age, disability, and family circumstances reclaim their homes with pride and dignity. And it has been a fantastic program and a fantastic endeavor. The second program that I'm excited to talk to you guys about is our Innovations in Nutrition program. This is funded by a grant through the Administration for Community Living and will utilize the Iowa Department on Aging's Encore Cafe replication model in order to carry out a 3-year initiative designed specifically to target Older Americans Act congregate meal participation, nutrition education, and physical activity among the elder, Hispanic, Latinx communities in Sussex County. And the goal of that project is to provide a culturally competent, innovative, and replicable service delivery model for congregate meals and nutrition and wellness to educate these older adults in Delaware, especially the Hispanic and Latinx populations, which have been hard to reach with our current array of services. So we're really excited to launch that in partnership with one of our meals provider organizations, Cheer. So this would provide a culturally and linguistically appropriate congregate meal setting for individuals in that population.
Fantastic. Thank you, Lauren. We're coming down to the end here. So it is 12:29. I really want to thank everyone, all of our guest speakers, all of the contributors that we've had, Dot, Patty, all the people that have asked questions. Thank you so much. We really appreciate it. This call was meant to educate, and I think there was a lot of great questions, and I learned a lot, actually. And it also gives me some food for thought as we look towards 2024. I think Pei-Jen and I have some work to do on some of our policies and thinking about our seniors and the activities. So this was a great eye-opening experience. So thank you, Pei-Jen, for having me host today. But I just want to remind everyone that here at the Y, we believe that all people deserve to be treated with dignity, compassion, and respect, regardless of their backgrounds or abilities or their age. And so we welcome everyone. We welcome and we want them to belong here. And so that's what we do. Thank you to our staff who have attended the call to learn more and for all you do for our community. You guys are the best. You rock. We love you. Have a great Memorial Day weekend. And if you have any additional questions, please reach out to Pei-Jen or myself or any of our speakers here today. This recording will be sent out and shared amongst our team. So thanks again. Love you guys. Have a good afternoon.